guidance for Utah, and we'll talk about low risk since that's the stage that we're in. As you guys know, we were only in orange for 2 weeks and we moved quickly to yellow, and so we're just trying to keep up in giving you the best information that we have. And I know we're all anxious to get to green, and that could be soon or later. We just really don't know, but everybody in the state is definitely working to get us to green. Okay, on our website, we have a lot of resources that we hope can help you. We have our data dashboard, which is updated every single day. Every resident has access to the most current data about the outbreak in our community. We have frequently asked questions. We have yellow guidance documents specific for each industry that's outlined, and then for individuals and high-risk individuals. And we have posters and signs that are available for you to print, and just other resources. So I'm gonna head on over there to our website and show you a couple of things. This is the main page of our coronavirus website. And you can see that every day, our total number of cases, total hospitalizations, and total deaths are there. We have been really lucky in Davis County, and all of our community has done a great job to protect those that are most vulnerable. We've only had 2 deaths, and those were both in March. So it's been a long time since we've had that negative of an outcome. Each day, I'm going to take you to our data dashboard first, right here at this tab. Each day, we do have cases trickling in, but you can see in this orange chart that basically we hit our peak and that we are trending down. And so we're just managing the disease a little bit every day. I did want to show you also, this graph here, the pie chart, shows the green area that most of our cases are known contacts. That's household contacts or someone that a person was nearby that was a positive case. And we know that most people are recovering well and recovering at home, but we do have some that end up in the hospital. We also know that our testing statistics are really good. A lot of people in Davis County have been tested. As you can see, over 15,000. So we know that a lot of people are getting tested, and our positivity rate is pretty low. Only 2.4% of those being tested are positive. So many people being tested are not positive. This phase risk indicator tab shows our more current data. So people often want to know, well, how many are in the hospital now, or how many active cases do we have now? And this helps with that. So currently there's 4 hospitalizations. And one of the important graphs on this page is the blue bars with the orange line, and it just shows that overall you can see over these last 5 weeks that we have pretty much plateaued. We did have this little dip, but overall it's been steady over these last few weeks, and that's really one of the main indicators that helped us to know if we could go to yellow, along with our hospital capacity and the way the disease is spreading in our community. All of those things are taken into account to help us move through these phases. Let me go back here. Oh, actually, I wanted to show you a couple more things on our website. So on our coronavirus website, we also have just a lot of resources like frequently asked questions here that has been updated to help answer things related to yellow as well as other coronavirus questions. We have this whole section, which is the yellow low risk guidance. This little button here, specific industry guidance, we can click on, and you'll see here that we do have personal services. This is where you guys could look to see how the Utah leads together, yellow guidelines kind of come together simplified. Let's see, sorry. And also I did want to point out, since face coverings are new for your industry for the most part, we do have a sample face covering policy with some really good videos and instructions about how to wear them, how to keep them clean, why they're important. And so that might help you if face coverings is new to you. Oh, let's see, I can probably show you a couple other things too. We do have a lot of resources down here towards the bottom of the website. There's resources for businesses. We have posters and signs where you guys can print these, Or if you would like us to get you some printed, you can request them from us. And then we have different types of resources for different industries here as well. Okay. You probably all know this, but it's really important to reiterate for work sites. How does COVID-19 spread? It's from person to person mostly, and through respiratory droplets, and when you're in close contact with somebody who is infected. And so that's one of the reasons why personal services was so hard to keep open through this high risk period, is because of that close contact. And so close contact is considered closer than 6 feet for 10 minutes. So we are experiencing many outbreaks in Davis County, and many industries are being affected. We've had outbreaks at food establishments and manufacturing plants and in healthcare settings. And so it's just really important to have those face coverings because that will help make that a lower risk exposure, especially when you are serving clients in close contact for as long as you are. So we wanted to show you that we've got some signs like this that are available, really emphasizing the 2 key points of 6 feet apart and wearing a mask. And we have other posters and signs as well about hand washing and other good practices to keep everybody safe. So the phase guidance provided by the state is really just to help businesses and individuals in the community balance health and the economy, trying to make everybody feel comfortable in business settings, and that customers feel like that they can be confident they'll be protected in your establishment, and that these guidelines are really put together by industry experts and health professionals, keeping all of those interests in mind. Everybody's having to sacrifice a little bit to try and balance this effort. And then just to give you just a high level, what does yellow mean overall? Really, there's still precautions in place. We're just dialing up or turning up the dial, not turning on and off the switch. And so as we ease back into this, we still need to maintain social distancing, wear face coverings when social distancing isn't or just difficult to maintain. And then the gathering size has gone up from orange to yellow to 50. And this is really kind of for private gatherings, family gatherings. However, in business settings or other groups who have an organized plan, they can have more than 50, but they do have to ensure that there is a plan in place to ensure social distancing and just to have all the right precautions. So that 50 isn't for every setting. Settings that have an organized plan can have more than 50. And then limiting travel is still important. And for many industries, symptom checking their employees and or symptom checking participants in contact sports is important, that nobody plays or works sick. It's surprising how many people are working sick and then how many new cases that leads to. So that's also important. And then high risk individuals, they continue to follow orange guidelines. They're still very at risk, extremely vulnerable. And so business settings need to keep that in mind, and then people in the high risk category just have to be extra cautious still. So that's that. I'm going to turn over the detailed pieces to Rochelle.
Thank you, Isa. Again, my name is Rochelle Blackham, and I am the Environmental Health Service Director. So I am going to share my screen. Just give me 2 seconds. Okay, perfect. So first, what I'd like to go through is the Utah Leads Together 2.0 phased guidelines. So we're currently on version 4.4, which was released on Friday. So we want you to have this link because, as you guys know, as well as we do, everything is changing so frequently. So as we move forward, there are updates happening. So we encourage you to look at the latest version as we move forward. But first off, I want to go over general business guidelines that are in several sections of this document. So page 2, 5, 10, and 20 all go over different sections for all general businesses. And then we will get into page 15, which is specific to personal services. So as we go through it, I plan to look at all these different items, but the first thing here is take reasonable precautions. As Jay and I are out in the field inspecting facilities and or reviewing plans, we realize that every single facility is different and every case is different. So we're asking businesses to fit the guidance to what works best for them, understanding that they need to take reasonable precautions. Next, we're going to go over remote working, symptom screening, social distancing in a business, strict hygiene, clean and disinfecting of the facility, mask or face covering, protecting high-risk individuals, and then other practices, and then we will get to industry specifics. So I do realize that we are going through this guidance, but we're hoping that you'll learn something still. So first off, remote working is still preferred. I realize that that probably does not apply to personal services. So we are encouraging flexible working arrangements, which again is telework and or rotating shifts. So as I've taken phone calls from personal service facility owners, one thing that I want to make sure that I emphasize is if somebody is exposed, whether that's through an employee or a client, then there may be individuals that need to be quarantined or self-isolated, which we will get into more in depth as we go through this presentation. But when we talk about rotating shifts, maybe you could break your stylists and or employees up into several groups, and certain ones work on certain days so that you don't have the intermingling of staff, which would reduce the amount of people that may be restricted from work during one time. Exercise discretion when returning to work. This is a topic we want to emphasize. As we work with all industries and our community, we want to make it clear that as we move through these different guidance, which is red, orange to yellow, or high to low risk, that it's more of a dimmer switch, that everyone slows into it or eases into coming back to work instead of just flipping a switch. So we want to emphasize that returning back to work should be like a baby step process. And then of course use online conferencing and emailing as possible in place of in-person meetings. So symptom screening. Monitor employees for symptoms and their well-being. When we get specifically to page 15 for personal services, you will need to monitor clients as well, so we can go into that specifically. But employees who become sick while they're working, please separate them from other employees as well as clients and ask them to leave immediately. And then, of course, sanitize the area or workstation that they were working in. And of course, prohibit employees who are instructed to quarantine or self-isolate by the health department. And I will show you a restriction letter to help you understand what that might look like. So a symptom log or questionnaire, this is monitoring employees for symptoms. The symptoms include a fever of 100.4 degrees Fahrenheit or above, trouble breathing, sore throat, sudden change in taste or smell, muscle aches or pain. Several questions that we're getting are asked, do I have to have them fill something out? Can I verbally ask them? How do I record it? All these different things. So we are not going to tell you exactly how to do it. What we are going to say is it could be a verbal where you ask the individuals upon arrival and or staff the following questions, and then the manager signs off with the date and the customer or employee name. Then one person has control of the document. If you do have it available to customers, we recommend sanitizing the equipment in between, which would be like the pen and or clipboard, so it's not being passed from person to person. I know there's different ways of doing this. I know several of you have an online appointment scheduler, so it's possible that with prior, an hour or so prior to them receiving a service. They could be prompted to answer the questions that way. We've seen people do QR codes where they can scan it with their phone and answer the questions. That's something that they're already handling themselves, and then it goes to a database that you guys manage. So lots of different options. Do want to point out the resource that we have available that helps people understand how to, or gives them guidance on how to do symptom screening, which is available on our website. So industry specific on taking temperatures. So industries like a restaurant and or a gym are required to take employee temperatures before shifts. You guys are just required to ask. So you don't actually have to do the temperature check, as I believe. So I will look. Oh, it does symptom checking of all staff at the beginning of each shift with a log. So you guys are required as well. I apologize, these guidances are changing so quickly. So anyone with a fever at or above the 100.4 degrees should not come into the facility. And then it asks, what thermometer should we use? That's another question we're getting a lot. So if you don't have access to a thermometer at this time, you may have to ask your staff and or customers to provide or take their temp right before they come. There are thermometers available. We'll get into small business requests for resources as we make it through this. There are infrared thermometer guns or temperature devices that are not made for taking human temperatures. But if you look at the manufacturer recommendations on those devices, they do say that if you point it directly at the forehead, realize that there is a 1-inch radius reading, and then use 90 to 94 degrees. The ones that are calibrated for human temperature readings, they should be taken within an inch. So just look at the manufacturer recommendations. If you have questions about the thermometers that you have available, obviously the health department can help you, and our contact information will be at the end. So wanting to talk about exposure to COVID-19. If someone is exposed to the virus, they will be asked to self-quarantine for 14 days. What we are saying exposure is that is when you are within 6 feet of somebody for longer than 10 minutes. So this really affects personal services because you're, whether it's you're touching their hair, you're giving them a massage, tattoo, whatever it may be, you are within 6 feet for longer than 10 minutes, unless you can cut really fast the hair. But in general, if somebody is sick and they were around you or you were around them, then you are going to be exposed to the virus. If you do not become sick within those 14 days, you can return to work. But if you were exposed and you go get tested and you're negative, you still need to self-quarantine for those 14 days because that's how long it takes for you, or could take for you, to develop symptoms. So even if you test negative in between the 14 days, we are asking you to self-quarantine for 14 days, and we can help give directions to you or your staff. So if somebody were to test positive for COVID-19, we are saying that they must be free of a fever and have improved symptoms for at least 3 days, and that's 10 days from first getting sick. So you can see that if an individual is starting to feel better, no longer has a fever, then they still, no matter what, have to be self-quarantined for the 14 days, plus have the 3 days of improved symptoms or fever-free. So if the individual test is positive and they've never had any symptoms, which is happening at times, they're asymptomatic, then they must still self-quarantine for 10 days since they were tested and were shown to be positive. And we can give more guidance on that when we do trace back contacting, obviously, the person who is positive. We interview them over the phone. We ask them questions. Where have you been? Who have you been around? And we're going to go from 7 days prior to when they became symptomatic. That's how far back we're doing the interviews. And we're going to ask them who they came in contact with. So when we do this, this is just an example we've put on there, the ABC restaurant. So I'm going to try to put this into personal service perspective. So if you had a client who became sick and they were tested and they were positive, that report gets submitted to the health department and we reach out to them, and we'll just say that their name was Amy. So we interview Amy, and Amy says, well, I was at salon ABC, and this individual cut my hair and dyed it, and it took 2 to 3 hours. So then we are going to contact the facility and ask you for your records of who cut Amy's hair, and we're going to look at where their workstation is, and we're going to look and ask you questions on whether or not all the stylists and or people working there had maintained 6 feet distancing at all times, and whether they had a mask on. This is going to differ, I'm sure, like case by case for each facility. We are going to be excluding workers who were around the sick individual, and that could be intermingling depending on waiting areas and different things like that. So this is just an example of how we issue exclusion letters. We would say these individuals cannot work based on the fact that they were exposed. So again, social distancing is very important when it comes to the COVID-19 because it can definitely help the spread. So we want you to maintain a 6 feet distancing from everyone. We understand that you're going to be working with one client, but we want you to stagger workstations. So that may require you to move booths or change schedules. But as you're working on one client, you and your client should be 6 feet away from other clients that are receiving services. And it is not recommended that anyone face each other. So again, limit employee to employee contact. I know you guys have break rooms. I know there's socializing going on because you guys have been closed, but we're really encouraging everyone to wear face masks and stay 6 feet apart, even when they're in the break rooms or socializing. Minimize customer interactions. So I know there's some best practices out there where people are waiting in their cars until it's time for their appointment to come inside to eliminate customer interaction. In your waiting rooms, they just need to be 6 feet apart. Maybe you remove chairs unless they're 6 feet apart to help minimize that interaction. And then limit group sizes as much as possible. Moving to strict hygiene. This is something that I think you guys do often because you're washing your hands between clients, but we're recommending that hand washing is frequent and making hand sanitizer, soap and water, and other disinfectants regularly available. Avoid touching your face. As far as coughs or sneezes, use best practice where you're coughing into your elbow to avoid droplet spread, and then do not shake hands. As far as cleaning and disinfecting, we would like you to regularly clean and sanitize the facility, which includes like doorknobs, light switches, workstations, all of your tools that you might be using, different products, make sure you're wiping them down. So regularly cleaning, sanitizing, and of course increased cleaning to high touch surfaces, which were some of the items that I noted, or you can look at the infographic. Immediately clean and disinfect if an employee gets sick, as I mentioned, and then disinfect between clients and customers. This may include weight rooms if you decide to open those, and definitely will include beds and or chairs that the clients are sitting in. As far as face masks and covering, they should be worn by employees and patrons when it's difficult or impossible to maintain 6 feet distancing from each other. So this comes into play in personal services. So the patron as well as the employee should be wearing a face covering. We believe it may prevent the spread of the virus, and it is particularly important when it comes to asymptomatic spread or individuals who are not symptomatic or sick when they test positive. Again, we believe wearing a face covering in the public is a a health measure that we're encouraging. We do not think that it replaces social distancing or hand washing, so we still want you to hand wash, we still want you to social distance. And again, with the face coverings, we don't want them to become soiled or dirty, so we're asking them to be cleaned daily. Of course, face masks through CDC is not recommended for children under the age of 2, or for anybody who cannot remove the face mask themselves. We want you to make sure that the face mask covers your nose and mouth, and that you can breathe through it. And there's some guidance that ISA showed you on the website. Again, requesting PPE. So there are state and local programs to help get you supplies if you need them, which include, face masks, hand sanitizer, gloves. If you are struggling to obtain some of this PPE or items, please contact the number listed on this slide. That's 801-525-5200. From there, you will most likely be sent, or you can fill out the assessment early. But there is a link on this website which will send you to an assessment and an order form. It's going to ask you what your type of facility is, how many employees you have, how many of these items you have on hand, how many you're requesting, and then that form will get sent to our logistics team to help get those products to you. When our face masks or face coverings required, they should be worn again by employees and patrons when it's difficult to maintain 6 feet distancing. You can see there under personal services, employee and patrons. We do understand that there are going to be times when the face mask interferes with services. Maybe that includes like a beard trimming, tattooing of the lips, could be hair removal in the face area. So we want you to ask them to wear a mask when it's possible. We understand that there's services that may need to happen in which the mask needs to be or can be removed. And again, face masks need to be available to the employees if social distancing cannot be practiced, which is in this case. So protecting our high-risk individuals, this is really important. Overall, this particular age group is heavily affected by this virus. So if they work for you, we're hoping to encourage remote work when possible, implement flexible work hours or staggering shifts like we spoke about. When interacting with high-risk individuals, everyone should wear masks and attempt to social distance, which is 6 feet, which is all the things that we're already asking you guys to do. High-risk individuals are pointed out in yellow on the screen. They're individuals who are over the age of 65 or have underlying health conditions. They may live in a nursing home, that sort of thing. So those are listed there. Other practices is to avoid handshaking or unnecessary physical contact. So obviously it's spread by close interaction, so we would like to avoid those practices. It also includes having contactless pay options. So I realize that some people have options to pay online. If that is not the case, maybe you could hand the device over to the customer while you hold it so that they can insert their card so you're not touching their card. If you cannot do it that way, you will need to sanitize your hands as well as the computer device in between each transaction. As far as other practices, obviously we would encourage non-punitive leave policies so that individuals feel like they can stay home if they become sick. I'm not quite sure that's going to be a problem in personal services because I believe all of you usually can maintain your own schedule and be able to adjust your appointments as needed. On here it says open doors or prop doors open. Those would become high touch surfaces if individuals were touching a handle as they were opening the door over and over, one person after another, or opening it to leave. So we do encourage door being propped open when possible, and limit unnecessary travel amongst employees when possible. CDC does have some guidance here that if you do visit high-risk areas, that upon return, that individuals should self-quarantine for 14 days. So moving on to some industry specifics just for personal services. You can see who it includes, but it's meticulous monitoring of symptoms. So symptom check of all your staff between shifts with a log that's available to the health department. Again, how you choose to do that, whether it's verbal, whether they sign it, whether it's electronic. We don't have a preference. We just want to see that you are checking all of your staff members. And then it does say they're just keeping a log or a record. Let us know if you'd like a template. We could probably help with that. As far as training schools go, follow all applicable Utah Leads guidance, whether that's school, restaurant, personal services. We understand that there are, I'm going to use hair schools as an example, but obviously we're still encouraging that classroom style or institution can be taught remotely or electronically, virtually, however you want to say it. But we do understand that there's going to be a need for personal services or practicing on individuals where masks can be used, and one-on-one instruction or within small groups is what we're encouraging for instructing the facility with a questionnaire asking about symptoms, travel, and any sickness in your, you can see that, but let's hope it doesn't go down. So do any a question asking about symptoms. Have you had any of the following symptoms? Have you had any close contact with anyone who's been diagnosed with COVID-19 and or probably somebody who is sick? So that next question again leads into that. Is anyone in your household currently sick? Have you visited or traveled to a place in the last 14 days where COVID is spreading? Have you traveled internationally? I realize that these are going to be hard questions to answer, especially when that person is standing in front of you trying to get their hair done. So again, I might recommend trying to ask these questions remotely or over the phone prior to them showing up. Both service provider and the client should be wearing face coverings, which we went over. Disinfecting between clients, so adjust appointments as needed to do this. It may take 10-15 minutes in between clients, so you can ensure that you clear off and wipe down your workstation, whether it's the beds, whether it's the products you used, the chair, any of the tools you may have used. So adjust the appointments as needed. Customer contact information is required. So again, because 6 feet cannot be maintained and it would be longer than 10 minutes, we're going to need to know if an employee of yours becomes sick and provided a service to 10 people that day. We are going to have to reach out to those 10 people and let them know that they've been exposed. So, and that's going to be we're going to make a phone call to you and ask for that information, and then we will contact those customers to let them know that they need to self-quarantine if we determine that they've been exposed. Again, I already talked about encouraging contactless payment and symptom checking with a log. So some things to remember with the COVID-19 is we're still learning about the virus and the causes of COVID-19. Currently, there is no vaccine to prevent this virus. The best way to prevent the illness is by not being exposed to the virus, which you have some things that you can do as an individual by social distancing and wearing a mask. We want to take extra precautions for our high-risk population. That's why we're asking them to still operate under orange guidance. And then individual responsibility. We really want to encourage individuals who become sick to do their part by staying home, businesses to do their part by, encouraging people to stay home who are sick and helping us monitor these employees and of course clients in this situation. And we do believe that you guys and all the businesses in Davis counties are partners with the health department and can really make a difference here if implementing these guidelines to prevent the spread. I wanted to share our contact information. So the environmental health line is 801-525-5128 as listed there. We would answer any business questions or sanitation questions you may have. I wanted to provide the nurses line, which you can see on the slide. So these are the individuals you can ask questions if there is an exposure at work or positive case or questions about quarantine. And then Isa briefly went over our website. We do want to share that link though, so you can feel free to get in there and look at the posters that are available to you. Our current message right now is Davis County safe, smart, and strong. We believe we can all do that in preventing the spread of COVID-19. And I'm going to invite Rob to talk about this slide.
Awesome. Thanks, Rochelle. So this is just my contact information. I also forgot to mention that I'm Rob Sant, the Economic Development Director for Davis County. So that first number is my direct line. So please feel free to give me a call if you have any questions regarding economic development, financial assistance, consulting, or any ways that we could help you. The next one is the number for the Davis Tech Small Business Development Center, located in Kaysville. So that is Andrew Willis's number. He's the executive director of the Small Business Development Center, and their whole purpose is to help small businesses with any need that they have, any consulting needs. So feel free to reach out to that number as well for any consulting services. That link is for the Commercial Rental Assistance Program. That was part of the $40 million that the state legislature set aside to help businesses with rental assistance. As of last week, there is still $30 million left. So that is the link to go on and get more information on that and to know how to apply for that. I believe you can get up to $10,000 to help go towards rental assistance. And then the last one is with Weber County, we formed the Northern Utah Economic Response Team. It's myself, Weber County's Economic Development Director, the Chamber of Commerce in both counties, and that website has a bunch of different links for different resources and other things that can help you during this time of need. So now we want to get to the Q&A portion. So we've had two questions already answered, but I wanted to just read the questions and the answers to that so you're well aware of it. So the first question was, while doing a massage session for 1.5 hours or 2 hours, face coverings for both participants, do the client need to maintain the covering while face down? And Jay Clark said, the exception for face mask use comes when the mask interferes with the service. The safest practice is to still have both the client and the provider wear masks at all times. But if it is difficult for the client to breathe in that circumstance, you may make an exception. I don't know if Rochelle, if you have anything to add to that.
Nope, that is the correct answer.
Perfect. And then the next one is, my main practice is muscle aches and pains. How do I figure out that if this is an issue for COVID-19? That's the reason why my client is coming in, is for muscle aches and pains. And again, Jay said, it's a great question. If the patron knows why they have discomfort, such as from a specific incident or movement, you could reasonably accept them for treatment of that area. However, if the origin of the aches and pains is unknown, it would be best to not allow that person in at that time. And then the other question that we haven't answered yet is, I've had a muscle ache for 8 weeks now, and I really don't know, other than I woke up one morning, so I don't think it's a COVID-19 issue. Am I excluded from having a massage if I don't have any other symptoms besides the aches and pains?
So, Rob, to answer that question, of course, anyone who is showing any symptoms has the ability to go and get tested. So in this case, I would recommend getting tested, just so you would have that reassurance of having a negative test, so that would provide a little bit of clarity to yourself as well as to the individual providing the service. That being said, we are not seeing COVID-19 symptoms last for 8 weeks, and so you're pretty safe on the fact that it has been occurring for 8 weeks. Normally these symptoms do not last, it's about 2 to 3 weeks. I heard a beep, but I don't know where that came from.
Perfect. Any other questions from the attendees? Feel free to put them in the Q&A or the chat. There's also a hand raise feature. So if you would like to let us know that way you have a question, you could please do that as well. And we'll just wait a minute to see if there's any other questions before we move on. Okay, so we have another question. How about if someone refuses to wear a mask because it's not law? Yes, someone has said that to us. What do we tell them?
Yeah, so I've had several personal service facilities come out and say that individuals has refused to wear a mask. Obviously, it is up to you on how you handle that as the facility owner. The guidance is clear that they should wear a mask, and as a service provider, you should have all of your clients wear a mask. I hate to tell you guys to refuse service if a mask isn't worn, because that is a personal hit to all of you. What we've been telling people is that it's clear in the guidance that they should wear a mask if they would like personal service, but no one is going to come and force them to wear that mask.
Perfect, thank you. And then the last question we have mask related also is, how long do you think it will be necessary for both clients and stylists to wear masks?
Isa, do you want to take that question? It's asking when we'll move to green.
Sure, yeah. Good news is when we move to green, face coverings aren't as big of a priority, but we really have no idea when that's going to happen. So the governor and the task force are reviewing the data on a daily basis, weekly basis. And so probably the next 2 weeks will be in yellow, and then we'll find out after that if we're staying yellow or moving to green. So hopefully it will be a short period of time, not forever.
Perfect, thanks, Isa. Another mask related question. If a client refuses to wear a mask due to claustrophobia or another reason, can we refuse service without getting in trouble legally with discrimination or another legal issue?
Yeah, so, oh, Isa, you came up. Do you want to answer that? Oh, okay. Sorry. Like I said, we're all social distance in our own offices, so sometimes it's a little hard. But to answer that question, I know that others are turning down individuals who are not willing to wear a mask, and I think that the guidance is clear that they has given to ask people to wear masks. So I don't think that you would get in trouble for refusing service.
Okay, any other questions? Oh, is there discounted products for sanitation, masks, etc. for businesses anywhere?
I noticed that in the governor's materials about the small business push packs for PPE that they did provide some links for businesses in Utah to order products. So I'll try and grab that really quick and put it in the chat.
Perfect, thank you. And then are there any fines or anything if the client refuses to wear the mask in the office? Are there any fines if someone, like, let's say they refused to wear a mask and then a health inspector came in and saw that people weren't wearing masks? Are there any fines related to that, to the owners of the businesses?
So from the health department standpoint, as far as environmental health, what normally happens is we receive a complaint about a facility allowing individuals into their facility without a mask. And of course, our primary or first step at that point is to provide education to the facility. So of course, we would go out there, ask what happened, tell you that the guidance says that both the patron as well as the employee should wear a mask, and that primarily fixes absolutely everything. Just reaching out, letting you know we had a complaint. Unfortunately, there are some times where we may have to take enforcement action, but that would be on an extreme basis, I believe, where you were not asking anybody to wear masks and it was constant and we had told you over and over to have people do it. If you have one individual client who refuses to wear a mask and you still do the service, it's possible we'll receive a complaint and we'll call you and give you some education or a reminder. We do not intend to go out and police based on that and issue tickets or citations to any patrons and or facilities for one person that refuses to wear a mask. Hopefully that answers the question.
Thank you. And then someone was curious, what was the tab, or where can they access all the information that you just shared, Rochelle?
So Rob, that may be a question for you. You recorded this PowerPoint presentation and it's going to be available on the website, which I'll let Rob speak to where that is on the website. But the guidance that I referred to is a 21-page document, which we included the website, but it is under the Utah Leads 2.0, and we included the link.
Perfect, thanks, Rochelle. And then in response to the website, we are recording all these webinars, and we'll post them on the main COVID-19 website. We have a little link that takes you to a business resource page, and we'll include a link to there too as well. So you can go back and rewatch this to get answers to those questions and to get to re-listen to Rochelle's information and ISA's. And then I can answer this next one. It's the person ordered a PPE pack but moved and was not able to get to the pickup time. Can it be shipped or dropped off, or do I need to reschedule a pickup again? So today I actually was over there helping this morning hand out the PPE packs. And if you weren't able to pick them up, I believe the plan is to give them to the city managers of the cities your business is located in. So if you ordered a PPE pack and weren't able to pick it up today, I would call the city that your business is located in, and they could put you in contact with the correct person. But I believe the plan was to give all of the remaining PPE packs that weren't picked up today to the city managers. Any other questions? Well, I'll conclude, and then if I see any questions pop up, we'll be sure to answer them. Yeah.
Hey Rob, one more question.
Yeah.
I apologize. As you guys know, we moved to the low risk guidance on Friday. So our plan here within the Environmental Health Services Division is to get out that one-page summary for personal services, and it's nicely simplified. As Isa said, the guidance pulls from all the different sections that are required and gives one sheet as an overview, and we'll be sending that out through emails today to the personal services, and I'm sure some of you have already been receiving our emails, and if you haven't, please reach out, but we will send that out today.
Perfect. And Jill, to answer your question about what the PPE pack is, so that was, the state made a push that any businesses that, oh, it's right there. ISA just wrote out a way better response than I was going to say. And then Kelly White just asked, is it necessary to ask each client the symptoms question each time they come in?
Yes, it is required to ask the customers the symptoms question, as well as if anyone within their home or within close contact is sick, as well as whether they have traveled, because that is the best precaution to take in order to allow someone who's sick or possibly exposed within your facility.
Perfect, thank you. It looks like that's all the questions. So just one last reminder, we'll be sending out an evaluation to get some feedback on this webinar. So please look for that evaluation link. We'd love to get your feedback and your suggestions for how we can improve. like I mentioned before, our goal is to be a resource for businesses and also in turn to help improve consumer confidence that it's safe to get back out to your businesses. So we might be doing some future webinars, so please help us by filling out that evaluation form. And thanks so much, and we hope you have a great day.